one key thing that someone recovering from depression or on the path to recovery from depression needs to remember is that they shouldn't allow the depression to take over their life.
One of the things that really wears you down or is a big part of the whole experience of depression is the fact that it doesn't go away.
Someone from looking from the outside might think, oh, you have everything in the world, why are you feeling hopeless about something, right? But for the person experiencing the depression, those things, that their hopelessness is real.
I have a mental health organization and I go around championing everybody else's mental health, and I'm like, no, you must take it seriously, you must take care of yourself. But I then come home and I'm like, am I faking it? Hi Vijit, welcome to my podcast, Call Me Hopeful, because I'm hopeful about where we're heading in the mental health space. For those of you who don't know, Abhijit works in Sangat, and he's a professor at the London School of Tropical Hygiene and Medicine, and he's a psychiatrist, and then there are a whole bunch of abbreviations after his name. I don't know what they mean, but it basically means that he's clued in and he's super into research, which means he doesn't just theorize and philosophize like I do. He sees things, he does things, and then he writes about them. Which means that even my self-sabotaging, irrational brain has to actually listen to what he says. I was diagnosed with clinical depression about 5 years ago, but I still have questions. And I think the way to stay hopeful is to keep asking those questions when they come up. So I was on mild medication, but I started therapy. It's been 5 years since I've been in therapy. I have a mental health organization and I go around championing everybody else's mental health, and I'm like, no, you must take it seriously, you must take care of yourself. But I then come home and I'm like, am I faking it? What is this? So, first, is it a thing?
Before your first, my first, this is probably the nicest introduction I have ever had about myself. People, when they speak about me, they kind of speak about all of the abbreviations that you spoke about, which you don't understand. Maybe most people don't understand, so it's not important. What you said today, I think, is very nice. I like it. I'll probably put that in my CV and ask people to talk about it.
I want credit.
Yes. So coming to a question, is it a thing? Yes, is the simple answer.
Okay.
Yes, it's a thing.
For now, just the simple answer. And before we get into it further, I just wanted to make a distinction. If we're talking about clinical depression, what does that entail?
Sure. I think I understand where this question is coming from, and I also believe it's very important to discuss this for several reasons. I mean, one being that what you alluded to, that people don't think it's a thing, so we need to be talking about it. But also at the other end of the spectrum is kind of a lot of misinterpretation of what depression is, and a loose use of the word for everything, from feeling a little bit low for a few hours to not feeling like doing things for a day. Everything becomes depression when it's not. And so I think it's important for people to understand what depression really is, and how it manifests, so that when you have it or when someone else has it, you are able to decide for yourself that this is what I'm having, I need to seek help for it. So what are the kinds of things that happen to people when they have depression? So there are two key or core experiences that people have. There's lots of different things that happen, but the two core experiences that people with depression have is, one is sense of deep sadness or melancholy, and the other one is a loss of interest or desire to involve yourself in any kind of pleasurable activities that you used to involve yourself in before. So those are like the two core experiences that people have. And there are a lot of other things we can speak about those, but I just want to kind of stay on these two and try to highlight the nature of these two to separate it out from you know, people feeling low for a short while, etc. And that's why people tend to misinterpret it, right? So when you're talking about depression and these symptoms, they are not fleeting experiences, right? These are intense, these are deep, these are sustained, and they do not generally fluctuate from hour to hour or day to day. Or even if they fluctuate not in terms of you having it and then not having it, right? So there might be fluctuations in intensity, but they are sustained experiences. Other than these two, if we were to just break the experiences of depression into three broad categories, right? What you feel, which is your emotions, what you think, which is your cognitions or your thought processes, and the way you behave, right? So if you get to have these broad buckets, so the things that happen in depression would be uh, loss of interest, as we spoke about, but also physical symptoms. Let's say, for example, feeling easily tired or fatigued, sleep disturbances, loss of appetite. Then the thought processes would be feeling hopeless about yourself, about others, about your future, that nothing is going to change, things are going to keep on getting worse for myself, and which is not most of the times grounded in any kind of reality. Guilt feelings about things that you have not done, but you feel that you have done. You think that you have done something wrong. There's you have kind of, for example, if you're a mother with a child, you kind of start feeling that I'm not a good mother, I'm not taking good care of my child. So there's kind of guilt feelings that come with that. And then the behaviors, you know, you try to you stop doing things, you start avoiding doing things, you prefer to be by yourself. So those are the kind of things that happen with behaviors. And then the emotions, I mean, besides feeling low, there are other emotions that come in as well. You feel irritable, you might lose your temper very easily, and that's mostly happens when you're triggered off by other people being around you, who want you to take you out of how you're feeling. You know, they think, yeah, what are you doing, come on, let's go out, get out of it, kind of thing. That kind of then triggers people off, people get irritable. So these are some of the things that people will experience when they have depression. The most important thing to remember is that everyone will not have all of these symptoms, because everyone is different. So people will have different combinations of these various symptoms that they experience. But for a person looking at it from outside, some of these things might not look real. So, for example, the guilt feelings that people get, or the feelings of hopelessness, someone from looking from the outside might think, oh, you have everything in the world, why are you feeling hopeless about something, right? But for the person experiencing the depression, those things, that their hopelessness is real, right? The guilt feelings is real. So that's something very important to remember. Even if it looks unreal to you from the outside, for the person experiencing these things, it's all very real and it's happening to them.
Since you brought this up now, I think it's important to highlight that a lot of the things you're talking about, people see as that's why you're depressed, versus this is happening because you're depressed.
Sometimes people kind of make judgments about people who have depression, right? So, for example, you're just being lazy, or you just don't want to do something, or your willpower is not good enough, and that's why this is happening to you, rather than the other way around, understanding that you are feeling like not doing anything because you have depression. You have lost the will to do things because you have depression. You are simple things like you're not wanting to go to work because you have depression. You're not feeling like exercising because you have depression. So it's actually the other way around. It's the depression which is stopping you from doing a lot of things. That it's a depression that's making you feel all of these emotions, rather than the other way around. And many times, uh, people's lack of understanding of this, um, um, you get to see it based on what people say. People will say things such as snap out of it, or get your life together. But the reality of the matter is no one wants to be like that. If someone could snap out of it, they would do that. If they could kind of get their life together, they would get their life together. It's not that anyone wants to be or feel miserable all the time. It's what's happening in your head that's making you feel like that.
A lot of times I had that, like I was hopeless, I was confused, I was lost, I was feeling nothing. Sometimes all of those things together. I think I'm a fairly intelligent person, and still something that seemed so, like I couldn't find a reason for this to be happening, and so it seemed really illogical to me, but it still had a very real effect on my life. And so I met a friend at a family gathering, and she also struggles with depression, and I was telling her, I feel like I'm faking it, and she was like, that's the depression talking. How could the depression be talking? Like, it seems so irrational to me when I'm trying to rationalize it. So can you sort of tell us what is going on when you say you have depression? Like, what is happening? Why is it happening?
So what causes depression then? Let's look at it. So if you ask any mental health professional, they'll always use this term biopsychosocial, right? It's very jargony and makes it sound fancy and cool. Let's try to break it down. What do we mean by biopsychosocial? And let's take the bio first, not because it's the most important, but because that's the one which is most commonly understood by people, which in itself has problems that come with that. But let's just look at the bio bit of it, right? So bio basically means that there's something happening inside the brain, whether it's something to do with the structure, how the brain is made, or something to do with the chemistry of the brain, what was eloquently called chemical locha in Munna Bhai. I think it's good. I mean, using those kind of terminology helps it more accessible to people, but also then creates problems, because then it kind of, in a sense, mm, you know, it's a kind of a reductionist approach, because depression is not just about the chemical locha; it's a lot more than that. But let's just look at that for the moment. So there are certain chemicals in our brains called neurotransmitters that need to be present in a certain kind of a balance and need to function in a certain kind of way for us to be fully functional, right? So there's something that happens with the levels of some of these chemicals which can lead to depression. So that's the very simple explanation of the biological part of it, right? But that does not necessarily mean that that in some people that can happen autonomously without anything happening, but in many people that's the final pathway which happens when a lot of other things are happening, right? So it wouldn't happen without that final link in the chain, but that by itself in most people is not enough, because there should be a reason why that imbalance happens, right? So that I'll come to in a while. And the other big thing that people understand around biological is genetics, right? So if there is a family history of someone having mental health problems, not just depression, but some kind of mental health problems, then the risk of other person developing depression is greater as compared to another person in whom there is no family history. But the flip side of that is not true. Just because you have a family member does not mean that everyone else in the family will get it. And just because you do not have anyone in the family with mental health problems does not mean that you will not get depression or any kind of mental health problems. So chemicals in the brain and genetics. That's a biological part. What's psychological? Certain personality traits that people might have. So, for example, low self-esteem, right? Or being dependent on people. So those are the kind of personality traits that people might have that put you at a greater risk of developing depression. And then the social, like what are the things that are happening around you, which are things that you might do yourself, or things which are outside of your control. So when I say outside of your control, things such as your socioeconomic factors, for example, or gender, traumatic events that happen in people's life, domestic violence, intimate partner violence, substance use, like for example alcohol, heavy use of alcohol. All of these things are things that are happening around you. Other things like chronic illnesses, diabetes, cancer, chronic pain conditions, certain medications that people can be on for certain kinds of things can also trigger depression, like steroids, right? So there's various different things that are inside a person and outside of the person, can trigger off depression. Again, everyone does not need to kind of tick all of these boxes to have depression. It's different combinations for different people. But also to remember that there will, in many cases, people will develop depression when none of these things exist, right? So you could just get depression. Now obviously there's something happening in the brain which is resulting in it, but none of these other things that I spoke about would be evident, right? So there might there might not be any trauma, you might not be using alcohol, everything appears to be fine in terms of stressors in your life, but a person develops depression. So that's the unknown. I mean, we while we know and while we continue to know more about mental health conditions and depression, there are still quite a few unknowns. But what we would very reasonably confidently say is that even if you don't find any of these other factors triggering off the depression, if you were to look inside the brain to look at its functioning, you would see that the final link in the chain, which is the chemical imbalance or the neurotransmitter imbalance, that's going to be there, right? Because that's the final thing that leads to the depression, right? But that can be triggered off by so many different things that we know of, but it would also be triggered off by something that we don't know of.
Okay, so how I'm understanding it is that, I mean, of all the things that you said, like there was a long list. And if I would imagine that if you look at, say, even the the psycho part of the biopsychosocial, psychological part, things like low self-esteem or being dependent on someone, it's sort of a culmination of experiences that you've had that have led to you having low self-esteem or being dependent on someone, or being a more like precautious person, or any of those things, right? So the psychological part is sort of who you have become until this point because of everything that has happened to you.
Yep.
So not necessarily to predict it at all, but just to understand why it could seem unknown, why it could seem illogical or no apparent reason, would be that there are just too many factors that could be coming together, whether you see them or you don't.
Oh yeah, absolutely. Now I get a question. Yeah, no, absolutely. Because there are so many different things that could potentially happen. Some of the things which are so insidious, some of the things that we just take for not granted, but things that we don't see.
Mm-hmm. So from a layperson's perspective, if I'm like, I don't understand what's going on, to say that sometimes we may notice things like a traumatic event or an illness or whatever that may cause you to not feel good or have a bad experience, and then whatever. But they could also be nothing really tragic that you can pinpoint and see, but it could just be many, 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 many little things that affect many, many other little things in your life, that then come together and would then push the gate of the bio part of it.
I'm not so sure whether it's important to know why it happened. Uh, Not always, but most of the times. Uh, One reason being that you might not be able to pinpoint why it happened. And it's not very unusual for people when they experience depression, or for that matter, any kind of mental health problem the first time. It's not very unusual for the person experiencing it, for the people around them, family members, etc., to do what we call as effort after meaning, which is you try to find out why did this happen? Why is this happening to me? Right? Or why is this happening to my loved one? Why is this happening to my family? Did I do something wrong? Should I have done something differently? That's not very helpful, because most of the times you'll not find something that's causing it. And many times if you find it, there is not much that you can do about it, you know? So for example, I'll just keep going back to this example of poverty because it's so ubiquitous and something that people can imagine, right? So you can't do anything about poverty as a treatment. We should be doing something about it at a policy level, but as a clinician or an individual, there is not much that you can do about poverty if it's a risk factor. uh, what is important is the distress that you're experiencing, right? It's like, what is it that you are experiencing? What is that distress that depression is causing you? Let's look at how we can alleviate that using the various things that are available to alleviate. I think that's the focus of uh, any kind of not just a clinical encounter with a mental health professional, but at a personal level as well. When you're thinking about it for yourself, if you've got depression, trying to find out the reason, I think, is not as fruitful as trying to figure out what can I do about it now, whether it's by myself or with help from other people. In certain cases, of course, there is a need to kind of focus on what's leading up to it, because these are things that we can do something about, unlike, let's say, with poverty. Um, and and uh, and in the absence of not doing anything about it, the chances are that the depression will not go away. So for example, what are these kind of things? So for example, intimate partner violence. If you're experiencing intimate partner violence and that's resulting in depression, however much you might give your antidepressants or medications for the depression or psychological treatment for the depression, as long as that risk factor is there, the chances of the depression going away is reduced, right? I think that's a long-winded response to your question.
No, because like you said, it is fairly chaotic and complicated, not in the sense that you have to worry about, like you said, how we got there. That is usually of negligible consequence. And it's more about what you do now that you're there, except for obviously the very obvious things that you should avoid doing.
Yeah. So I mean, I probably use the example of diabetes, right? Look, when people get diabetes, they don't worry about like, why did I get the diabetes? You just get on with doing what you need to do next.
Mhm.
We speak about the stigmatization of people with mental health problems, right? But there is historically within the medical profession stigmatization of mental health professionals as well, right? As psychiatrists.
You always ask a psychiatrist why they decided to be a psychiatrist.
Yeah. So I think when that happens, psychiatrists feel an intense pressure to prove that whatever they are doing is scientific, and there is nothing more or nothing easier to prove as scientific than chemicals, right? You say, I give this medicine, chemicals change and people get better. Voila, magic. That's the biological bit of it, right? So to a certain extent, that is also shaped by that intense desire to kind of show that what I'm doing is medical, is science, it's evidence based, and some of it comes from there. I think that needs to change. I think that needs to change because there is a lot of scientific evidence now around the psychosocial bits of it as well, right? Which again, we know that that psychosocial works through the same chain. So as I said, the last link in the chain is the chemical bits of it, right? So when you do the psychosocial as well, so for example, when you do a psychological treatment, that has been shown to lead to changes in the brain.
Mhm.
So it's not, it's not some pseudoscience, or you just talk to people and people feel better. You do that in a scientific manner, and that leads to changes in the brain. So if you're concerned about, I don't get credibility as a person of science if I do psychological and social treatments, then that should allay your concern.
Mhm.
Because now I'm telling you that there's evidence to show that if you do that, that leads to changes in the brain.
I was talking to someone and they were asking whether science has reached a place in which you can like put wires on my head and simulate what someone with depression is going through. And when he said that to me, I was like, maybe, but one of the things that really wears you down or is a big part of the whole experience of depression is the fact that it doesn't go away, or just the time aspect, or the fear that you now have of the experience once you've experienced it. And so, like, there are all these compounding other factors that affect all of it. And so, just like, I was like, I don't think you can, like, even if they manage to be like on off switch, on, you now suddenly know what it feels like to be depressed, and off, now you don't. Because we were talking about how difficult it is to understand what someone is going through, actually. Because of, all the things you mentioned, there's so many aspects going on. You can't see them. They don't seem very obvious, but then they all affect everything. And then on the flip side, you can do all of these little things that sound like that shouldn't have such a big impact on my life. But then it does.
If you look at many kinds of illnesses outside of the mental health domain, many of them do have, even if they're physical health problems, they have a psychosocial bit to it, which we don't think about or talk about. So, for example, let's say cardiac conditions. Cardiac conditions sometimes may be purely biological, but sometimes it's a result of your lifestyle, which is social, and sometimes it's a result of stress, which is the psycho. Or, for example, ulcers, gastric ulcers. Uh, there is a biological to it, certain kinds of bacteria which can cause certain kinds of ulcers. There is the lifestyle bit of it, like your meal times and how you take meals, etc. And there's a psychological bit of it, which is stress. So, or let's say diabetes. There is the biological bit of it, but there's also the social bits of it, which is your lifestyle. And there's the psychological bit of it as well, in terms of the future outcomes of your diabetes, right? So with physical health problems, we just take it for granted that it's biological. We don't think that there are psycho and social bits to it. And with the we try to apply the same paradigm to mental health problems. I think it's biological, because I think we, as humans, we are a lot more comfortable with things that we think we understand better, and things which we think have a better control over. And biological is that, right? Like you say, oh, the chemicals imbalance, and that's why this is happening. It's easier to grasp and easier to respond to as well. When someone says, you take this medicine, the chemicals will be fine. Whereas the psychosocial bits of it are a lot more complex, and that's why we're kind of looking for the credibility for it, when in reality, if you ask me, if we start looking at everything through the biopsychosocial lens, then there won't be a special requirement for only mental health problems to prove that there is a biopsychosocial thing, because the like we are human beings. We do not exist in a biological vacuum. We live in a world which has different things happening, which affect us in different ways. So there is no way that anything that happens to us is not affected by anything happening around us. whether it's a mental health problem, or it's a physical health problem, or it's a physical health problem which is caused by a germ or a microbe or a bacteria, tuberculosis.
Hmm.
Again, one argues that it's biological. You get tuberculosis because a certain kind of bacteria goes into your body and you get tuberculosis. But we neglect the fact that undernutrition,
Hmm.
which is a very social thing, increases the risk of developing tuberculosis. We forget the fact
Affects your
that
immunity.
we forget the fact that overcrowding, which then comes with poverty, is an increased risk factor for tuberculosis. We forget that drinking alcohol heavily, is an increased risk factor for tuberculosis. So we try to kind of focus on things that we understand easily and can resolve relatively easily, and kind of not, and then everything else that is complex becomes a blind spot for us.
Yeah.
I've thrown you off.
No, but in a very interesting way. Because I think that
So if I may, what I'm trying to do here is, instead of trying to say that mental health problems are like every other physical health problem, what I'm
Yeah.
trying to say is
Physical
physical health
health
problems
problems
are like mental health
are
problems.
like mental health problems. Yeah, no. So that's what I'm seeing, that I was also trying to, because sometimes, clearly, based on what you said, it's easier for us to explain things through a physical anecdote or something like that, because then we have something to imagine, something to relate to. Whereas even in the physical space, there is usually more to that than just what we see. And also, when we look at anything, really, most of the times either we forget what happened before, or we forget what will happen later because of that. As in, we look at all problems in isolation. So having depression or going through an experience of depression will now not only be the depression, it will be the fear of the depression and the fear of everything that I could or could not do because of that depression. So now, even though I may not, so now with the depression, I have this added fear. Or with diabetes or whatever it is, I can't eat the things that I want to eat, which has an effect on social interactions that I have, because now I have to deal with the peer pressure of my friends eating cake when I can't eat cake, versus everything that leads up to that. So I wanted to talk about depression and understanding it from in the hope that we find some sort of tangible, not necessarily tangible, reachable, within our reach kind of things that we can do or think about or look out for, either for ourselves or in someone else. And what I'm gathering from what you're saying is that looking at everything that happened before is helpful to only a certain degree in relation to what you need to change for the future. Otherwise, only now and what you do from now on will really have an impact on making you feel better. So from what is helpful and useful, that would be what to focus on. And that it's the little things that may sound completely redundant that will have this ripple effect. And that the biggest part of all of this seems to be that we need to keep convincing ourselves of the validity of those little things, because it just doesn't seem enough.
Yeah.
I just sort of wanted to tie up the whole thing a little from the point of view that, okay, it's a mess. it's chaotic, and it's not necessarily um, it's not necessarily hopeless. It's actually quite hopeful, because what you said is, stop trying to convince the world or yourself that it has to be like there has to be a valid reason. You're feeling it, so it's there. Stop fretting over the why, and let's do something about it. And you don't have to do a big, huge, drastic thing about it. You just have to do lots of little things about it, which is a mindset shift, for one. But it's actually a pretty hopeful thing if you realize that it's the little things that you have to piece together, because little things we can do and then piece them together. If you had to explain to someone who's trying to help a loved one, just because even after everything you've said, it's difficult to wrap your head around, do you have a way in which you would think is the most useful, helpful explanation to give a loved one?
First of all, addressing this thing about faking it, right? So, the distress that depression causes is difficult to fake. And it's difficult to fake on a sustained basis, right? Like, why would someone choose to be miserable? I can't think of a reason why someone chooses to be miserable. People will be miserable if something is making them feel miserable, right? And they can't do anything about it. The natural human instinct is to get out of a situation that makes you feel miserable, right? So I don't think anyone will actively choose to be miserable. So faking it, to me, does not work, or faking it for a sustained period is just not a thing for me. So I don't think anyone should be thinking, if someone is showing sustained symptoms or experiences of psychological distress, that they are faking it. So that's one. The things to then look for in terms of both for a person who is looking at it from outside, like at a loved one, or someone who is experiencing it themselves, uh, all these symptoms that I spoke about, right, is the sustained nature of it. So what do we look for? So are these experiences sustained? Are these experiences intense, like very intense? And are these experiences affecting your functioning at various levels? Your interpersonal functioning, your social functioning, your occupational functioning. If it is affecting your functioning, then that's something that you have to be worried about and think that this is something real that's happening. I don't know what this is. I'm not understanding what this is. Then I should seek help for it. So I think that those are the things you should be looking at. But I'm completely thrown by this whole faking it thing, because I just can't for the life of me imagine anyone wanting to live with, or intentionally not live with, anyone intentionally uh, portraying the kind of distress that comes with depression and wanting to continue portraying it in a sustained manner. I just can't think of, because if someone is doing that, as in some if someone is, let's say, for a moment, assume that someone is faking depression for 6 months, 12 months, then they might not be having depression, but there is something wrong that's making them do that, right? Which is psychological. So there's something wrong that's making them do that, otherwise that person wouldn't be doing it. And that something wrong needs addressing as well.
Mm-hmm. Is there a cure? Is that a helpful question to think about, consider, or is that just a silly question to consider?
Is there a cure for diabetes?
I don't actually know the answer to that question.
Okay, so
no, I don't think so. I think it's lifelong management.
So it's treatable, but it's not curable. If your definition of curable is that, will it go away completely with treatment? With regards to depression, the answer is yes and no. So, because there are various ways in which depression can evolve. So, one pattern is where someone can get a single episode of depression, usually when it's triggered off by a particular life event or a stressor, and when that goes away, the depression will go away. You don't ever get it again. So there might be people who might get a single episode of depression, it never happens again. There might be other kinds of people who will get multiple episodes of depression, but between those episodes of depression they go back to full, what we call as pre-morbid functioning, like how you were before all of this started. You go back to that optimally. And then there'll be others in whom there'll be suboptimal recovery in between those episodes. You don't go back to 100% how you were before all of this started. And then the final one is where you kind of get depression, and it kind of, it's simmering around in the background, it's fluctuating a little bit, but it never uh, goes away to an extent where you could say that there is at least partial or full recovery. So that's the other one. So to answer your question about whether it's curable, one could argue that this first example that I give, you get a single episode and goes away, then the curable paradigm applies. For the rest of the different types that I spoke about, it's treatable, which is what you give treatments which ensures people kind of it reduces the depression, the intensity of the depression, it reduces the frequency of the episodes of depression, it increases the time period between the episodes. When you get it, it's not as intense as it was without the treatment, and it allows you to function. So all of those different kinds of things that happen, which again, equating it with diabetes, and I do this, and many psychiatrists will do it because it's easier for people to understand. We talk again in terms of a physical illness, is that once you get diabetes, you go to a doctor, and you might make lifestyle changes, dietary changes, medicines, and the blood sugars come under control. It goes on for a while, and then something might happen and the blood sugars go up. You go and see the doctor might advise something else, tweaking of the medication, tweaking of lifestyle, blood sugars come under control again. Goes on for a while, and for some people that might be it. They never need to kind of make any further tweaks, but they need to remain on the medications. For some other people, then you might, again, it kind of, that balance shifts a little bit. So it's that kind of a situation for many people.
You can still live a happy, fulfilled life.
Absolutely. I mean, the most important thing, I think, a lot of important things that he spoke about, but I think one key thing that someone recovering from depression or on the path to recovery from depression needs to remember is that they shouldn't allow the depression to take over their life. And what do I mean by that? So, for example, let's say you've had an episode, you got treatment in whatever manner, you're feeling better now. You can't be living in constant fear of the next relapse, like when is this going to happen, or should I be doing this, or should I not be doing this. You have to be mindful that this is there, I have had it, there are chances that I might get it again. There are certain things that I need to do to reduce the chances, but you can't make that the definition of your life. I think that's very important to remember. And so your question about happy, healthy, fulfilling life, all of that is possible.
I like to ask every guest if they would like to make a pledge of sorts, which is kind of not really like a pledge, but more like a hopeful, actionable step.
I think I find myself in a position in my career now where I can help strengthen and empower other people and organizations in the country who would want to do more within the mental health space. And when I say want to do more, I'm not talking about clinicians. I'm talking about people like yourself who want to advocate for and raise awareness about mental health. I think I would be more than happy to give my time and efforts to supporting people and organizations like that.
Okay, thank you for that whole conversation, even though it went a little all over the place.
Thank you for having me on the podcast. I hope I've not increased your confusion more than it was before we started this.
We'll ask the audience, comment and let us know. Hello, So, this is Ira Khan, and that was Call Me Hopeful with The Swaddle. To listen to more such episodes, subscribe to The Swaddle on YouTube, Apple, Spotify, or wherever else you get your podcasts from.